the same page. Oh, and thank you for that. So let us know if you have any issues with recording. And so these are the acronyms that we'll be using and should be familiar to folks by now if you've joined other sessions or if you've been interested in CalAIM. And so just leaving them for a second here. And when we send out the slide deck, you'll be able to have these as well. They are just describing Department of Health Care Services. When we use MCPs, we mean managed care plans, CalAIM, and then the two kind of benefits here, ECM and ILOS. We'll be focusing on community supports, which was formerly known as ILOS, for these sessions. Just to kind of recap where we are, if kind of wherever you've joined us in this journey. So we've either been, we had a set of regional sessions so far, which happened on November 1st. We will provide the unlisted YouTube link to that if you're interested in joining that. The link to it is not publicly available, but is available for the CBOs that are, part of this project here. We focused on, describing resources and relevant information, and we'll actually do a little bit of a review of what Regional Session 1 encompassed in today's session, just to make sure folks have that backgrounding. Then the second session is today's session, which will be the last one in our series here for regional sessions. Again, these are for all 4 counties that are part of our project. We did have one statewide session in the middle of November, and we will have another one in December. This was related to key contracting considerations for CBOs. We built on that for our specific TA sessions that are divided up by counties. So on November 23rd, we had our first TA session for San Joaquin and Stanislaus CBOs. Some of you may have been on that. And then this afternoon, we're having our first TA session for Sonoma and Shasta County CBOs. And so this has kind of been the cadence and the delivery of TA provision so far. We still have a statewide session and a TA session for each of the county-specific CBOs coming up for us in the weeks ahead. So by the end of today's session, what we're hoping folks will be able to do is describe the goals for this partnership network, really understand who key contacts are at your partner managed care plans and how to contact them. We know that in the process of kind of reaching out to CBOs and learning, we've heard that there have been questions about, well, who do we reach out to? When can we reach out to them? With what questions? That kind of thing. So we're hoping we can answer some of those as we go through today's session. We have representatives from all of our plan partners here. We want to, recap some of the topics and resources that were addressed in prior regional sessions, as I mentioned, so that folks kind of have the same grounding or at least know where to go to get that information that was shared previously. And then we'll do a portion on understanding the requirements and processes to really, register and become credentialed with managed care plans. So I hope that is what folks are here for. Kind of following from those objectives, this is the agenda. You'll see this note here. So, really feel free to share questions in the chat. And, our implementation partners on the line, the folks that we, gave thanks to at the beginning, our managed care plan partners are on the line. And so to the best of everyone's ability, folks will try to address any questions. And then also we'll be able to keep them in the back of our list as well. If it can't be addressed in this venue, we'll be able to share it with our partners and our plans to be able to do that. So I'm wondering if at this point I can maybe turn it over to Rishi, my colleague at HealthBegins, to run through some of this backgrounding and objectives.
Thanks, Sadhana. Can you guys hear me?
Yep.
Wonderful. If you can advance the slide. Hi, everybody. Rishi Manchanda. I'm CEO at HealthBegins. I work with Sadhana and Nasra and Alexis on our HealthBegins side. And again, I just want to say my thanks to everybody for joining today. As a quick recap of sessions information that we've covered in past sessions, we want to make sure everybody's grounded in CalAIM 101. As you all know, it's a multi-year initiative led by DHCS to transform the way in which Medi-Cal beneficiaries receive care, building on Health Home Program and Whole Person Care pilots, and now transitioning into a new phase starting January 1st of 2022. Community supports, in particular, which is going to be a focus for today, and much like many of the sessions we've run in the past couple of months, community supports are services that Medi-Cal managed care plans, or MCPs, are strongly encouraged but not required to provide in lieu of or as a substitute for utilization of other services or settings such as hospitals or SNF admissions, discharge delays, or emergency department use. Community supports are really the kinds of support services, as you go to the next slide, that we know many community-based organizations can address. To realize the vision of CalAIM, we, over a year ago, working with our partners at Aurrera Health, with support from California Healthcare Foundation, and alongside the implementation partners that we have, many of whom are online today, we recognized that we needed a new approach to support both near-term and longer-term infrastructure for community-based organizations and plans to work together in furtherance of the broader CalAIM goals, and especially when it comes to community supports. There are a variety of reasons that you can see there for why we wanted to do that. But the bottom line is that we were fortunate to receive some funding earlier this year to create a design process and facilitate a lot of conversations with stakeholders across the state, including perhaps some of you, to be able to think about how to structure something in the near term while everything is still, at least a few months ago, things were still unknown in terms of how plans and how the state and certainly how CBOs could work together in CalAIM. We wanted to at least create a space to convene conversations and provide CBOs with the ability to understand how to improve their readiness for contracting through direct or indirect means. The work that we've done now is to take the lessons from the inquiry design process in the beginning of the year and now create this. What we've done is to create a CalAIM Medi-Cal CBO Partnership Development Network. It's a mouthful. We welcome suggestions for shorthand branding from all of you, but the point of the CalAIM Medi-Cal CBO Partnership Development Network is to provide these short-term intensive learning sessions, both through statewide sessions, so all CBOs can learn a bit more about the opportunities, but especially within the regions, the 4 counties that we've identified. So if you go to the next slide, Sadhana, I can walk through some of our assumptions about, based on this background, based on what we're trying to do here, our assumptions about today's audience. We think that all of you, and hope that all of you represent, or many of you represent, California-based CBOs that support community support services in Sonoma, Shasta, San Joaquin, and Stanislaus counties. We also recognize and welcome any representatives from county agencies from those counties who might be joining us today. And we also assume that all of you are interested in partnering and building and strengthening relationships between managed care plans and CBOs in the context of CalAIM. If you go to the next slide. We thought we'd now, based on our assumptions, now try to validate them by just putting an audience poll out there just to get a sense of who's on the line. So let's launch the first poll. The first poll being to understand a bit more about which of the following community supports your CBO is hoping to provide. And we want to launch this poll to see, you can select all that apply when you see this poll launching. So Nasra or Salva, do we have the poll ready to launch?
Yep, I think Nasra will be able to
Great.
Launch that. And I'm getting a few direct messages about how folks might have to jump off a little early and asking about the recording. So I just wanted to address that and say that we will be sending out that unlisted link for the recording following the call. So to everyone that registered, or sorry, that was invited to this session.
Thanks, Alan. Thank you.
Mm-hmm.
And I think you'll be able to see how many people have taken the poll better than I. So just let me know when you want to close the poll.
So I will, I think folks are still entering answers in here. So I'll leave it for just a little countdown. We have a little under half of folks jumping in. And so I'll count it down from 5, 4, 3, 2, 1, and then that's right. You can close the poll and share the results. Yeah. Are you able to see that, Rishi, or should I voice it over?
Yeah, I can see it. Thanks. So as everybody hopefully can see, nearly 6 in 10 of CBOs who've answered are looking to or can provide housing related community supports. about a third, a little over a third for medically tailored meals or medically supportive food, and then about 3 in 10 who were able to provide recuperative care services. And then there's a smattering of other and also community transition support, environmental accessibility adaptations, day habilitation programs, and then don't know. If you answered don't know, feel free to put any comments in the chat just to clarify either questions you have, or if there's another way of describing the kinds of supports or services that your community-based organization provides, even if you're not sure if it aligns with one of the 14 different community support categories that have been identified by DHCS. So feel free to, especially if you answered don't know, please feel free to enter some clarifying comments or questions in the chat. But let's move on to the next. This gives us a really good sense of who's on the line. It validates to a certain extent that we have people on the line and who are consistent with the stakeholders that we want to be reaching out to as a team here for this work. Specifically, potential community-based community support providers. Many of you who have indicated the variety of community supports that you do provide. We're seeing that many of you have the opportunity, it looks like, if you so choose, to enter into managed care plan arrangements, contracts, to be able to provide community supports. We certainly want to make sure that this is a space for Medi-Cal managed care plan staff and leaders to be able to participate. And we, again, really want to thank those who've been not just here today, but have joined us throughout this whole process to be able to be present and available to answer questions and facilitate the process. We also know that there may be some community-based ECM providers, enhanced care management providers, who are in the line, and so welcome you as well. And lastly, but not least, we recognize that county staff are another key stakeholder for this partnership development network. One important point, though, is that while managed care plans will be responsible for administering enhanced care management and community supports, counties, we know, are critical partners in implementing and ensuring the success of these initiatives. And while all of these stakeholders, including but not limited to county representatives, have capacity building needs and opportunities, these sessions, including the one today right now that we're providing, as well as the county specific TA sessions, are designed primarily for community-based community support providers, meaning community-based organizations, as well as the plan staff. That's of all the different stakeholder relationships, the one in particular that we were charged to help support, and primarily were the relationships between CBOs and managed care plans. So we welcome all of you as key stakeholders to this call, and now you have a sense of who where our focal point is, so to speak. If you go to the next slide. We wanted to, based on that focus and the stakeholders that we wanted to address through this session today and this whole project, we wanted to get a sense of where you're at, especially if you're a CBO right now who answered the last poll question. So Nasra, if you can launch this next poll question, and we'll leave it open for 30 seconds. How far along are you in the CalAIM community support contracting process with a managed care plan? So again, please only answer if you're a CBO. Either you have not started or have decided against contracting, or you're just starting conversations. You're perhaps waiting for a contract, having already had some initial conversations. You're reviewing your contract, or you're actively in contract negotiations. And so if you can just use the poll questions to answer, that'd be great.
And folks are still answering, so we'll give it a second. I think folks can enter one answer here, and we know folks might be in different contract negotiations, kind of depending on how many counties you're serving and that sort of thing. So just pick the one that kind of best represents how you're feeling overall.
There's a note from Catherine Couch in the chat. Sorry, I just wanted to elevate that. It's a really great comment, Catherine. Thank you for joining and for raising that. You've signed a contract, so congratulations first for a serious community project. And you're right, it's not an option, in part because we've had a bias towards supporting CBOs that are earlier in the journey who have not yet signed or exploring contracts. We know that there are several CBOs who have both a lot of experience, may already have existing or had existing contracts and are now repurposing them. And so we really appreciate that there's a spectrum of CBOs represented today, including those who've already signed contracts. It's a very good point. We might consider adding that option for the next session here, but I think the poll answer choices reveal our bias to try to help support those who are earlier in their process to just further them along in terms of readiness for contracting. So I really appreciate that comment, Catherine. And also for you and for others like Sandra who have already signed a contract or in negotiations, for those who are further along in the process, we really do invite you today to not just listen, but feel free to weigh in if you see questions from other CBOs that you feel like you can address. Thanks, Adam.
That's great. And so I think we can close out the poll now.
Oh, great. Wow. I will note that this is a shift from the last regional session that we had, where many were earlier in the journey in terms of just starting conversations or having it started. We're now seeing an overwhelming number of people who are on the line today, at least, are actively in contract negotiations. So kudos to everybody on both the CBO side as well as the plan side. That's great. And so based on that, this will, I think, inform the tenor of, I guess, today's conversation, the kinds of conversation, the dialogue, especially with our plan partners at the table today. So let's go to the next slide if we close that poll out. And just reiterate then for those CBOs, especially those of you who are at various stages of contract negotiations, to understand that our goals for you are to support you so that you're better able out of this process to describe the essential components of contracting, better assess your own strengths and areas for improvement, to engage in contracting partnerships, develop the relevant knowledge and skills, both through the TA you're going to receive today, but also through the connections that we're creating through this space. And through those connections, strengthen your relationships between yourself and managed care plans and other TA providers who might be on the line today. And finally, we hope that through this process, you're further along, we're supporting you to move further along in your planning and to be able to engage in contract relationships. So being able to draft a plan by the end of this, if you don't already have one, for how to engage in contracts is a major goal for us. For the plan side of the next slide, we're hoping that this is mutually beneficial, this space, and that so far we've seen this to be a helpful opportunity for both CBOs as well as the plans, managers and staff in particular of the plans, who we hope this benefits by being able to just help save some of your time to be able to better and more quickly assess the readiness and capacity of multiple CBOs who might be community support providers for you, again, strengthen relationships, help you define your provider capacity, your provider network, especially consistent with your model of care submissions to DHCS, and support overall planning for incentive performance, measure goals, and being able to engage and educate a larger number of CBOs than you might otherwise have the ability to do about basic CalAIM requirements. So we're hoping this is beneficial for CBOs, and as this slide indicates, for plans as well. The next slide. Because we have not just the goals stated, but because we have the plans represented here, this is a great opportunity, I think, to really introduce, and I'll ask anybody from HealthNet, Health Plan of San Joaquin, and or partnership who's on the line today to go ahead and unmute. If we can start with HealthNet. If you're on the line today, if you can just unmute yourself, introduce yourself today, that'd be great. We want to make sure that folks have a chance to hear from you. And again, thank you for joining.
Great, thank you. Yeah, thank you, Rishi. This is Nye Kasich from HealthNet. Just wanted to thank everybody for calling in and taking time out to, receive information in regards to community support services and the next steps. And I just want to thank everybody again for calling in. I want to also introduce one of my team members in case there's any questions related to our efforts from HealthNet side. It's myself and Anna. So I'll have Anna introduce herself.
Good morning, everybody. My name is Anna with HealthNet. Thank you, Nye, for the introduction. So I'm in Sacramento, but I cover San Joaquin and Stanislaus County.
Know that Nancy was unable to join today, so apologies. But Nancy is Senior Director of Health Systems of Care, and so she's also another contact person from HealthNet with any questions or inquiries. Thank you.
Thank you, Nye. Thank you, Anna, for joining. Yeah.
I just wanted to say, we know Nancy's been on most of the other sessions and has been really actively involved. So really appreciate all three of your involvement on this. Health Plan of San Joaquin, do we have Jeanette or Cynthia on the line?
Hi, unfortunately, Jeanette couldn't make it, but I'm here. My name is Cynthia Pena, and I'm the Director of Special Projects. I'm happy to join everyone on the call this morning, and I'm happy to collaborate with both our CBO and health plan partners on this active discussion. So I'm happy to take any questions that come forward afterward as well. Good morning.
Thank you so much, Cynthia. And likewise, Jeanette has been so helpful in like kind of the lead up and design and input through this process. So really appreciate both of you. If we could go to Partnership Health Plan next.
Sure, I'll start. My name's Amy Turnipseed with Partnership Health Plan. I'm joined by colleagues. I'm going to start off. Lisa's not able to make the morning session, but Brooke Vance from Provider Relations is joining us. So Brooke, do you want to introduce yourself? Well, Brooke's on mute, but she's from our Provider Relations team. So if you have any questions related to Provider Relations, she's joining us. And then I will turn it over to Deb McAllister.
Hi, I'm Deb McAllister. I am the Associate Director of Strategies here at Partnership. And currently that means all things CalAIM community supports. Danielle?
Hi, good morning. My name is Danielle Diasodi, and I am a Senior Program Manager here at Partnership Health Plan, and I'm leading the Enhanced Care Management Benefit Implementation alongside with Deb with the community supports. And we have created an email box for any kind of inquiries related to CalAIM, the community supports, and ECM or Enhanced Care Management. I'll share in the chat should you have any questions to reach out to us. Thank you.
Danielle, thank you for that. And actually, I'll take that baton and elevate it here. Danielle, as you share your contact information or the contact information for Partnership, invite our colleagues from Health Plan of San Joaquin as well as from HealthNet as well to include information in terms of the appropriate email address to use for CBOs who may have follow-up questions, especially because we know some CBOs may not be able to join for the entire duration of today. So invite our plan partners, first thank you, and invite you to include your contact information, relevant contact information in the chat. And on the heels of that, actually, this might be a good opportunity for everybody to go ahead and please put your name, your organization, and the county that you're located in, or the counties, plural, if that's the case, in the chat too. So your name, your organization, and then county or counties that you're working in, please, in the chat. That'd be hugely helpful, especially for our plan partners who are getting a sense of who's in the room. So we'll get that process started. And as we do that, we're seeing perhaps some of you whose names are already on the list here on the line today. We also recognize that there are a number of CBOs that have been identified or recommended by a number of different sources, including not just the plans themselves, but by various community coalitions, organizations, word of mouth. There's a variety of different ways in which we've been hearing about and inviting CBOs. And so if your name is on here, thank you for joining. If your name is not here, please, again, put your name and information in the chat so we can identify all the CBOs who've been identified and are participating in this. And then lastly, if you know of any CBOs, community-based organizations who are not on the list or not here today that you think would benefit from participating in the upcoming TA sessions, please do feel free to, we'll give you information at the end of today about how best to contact us. One of the best ways is through completing the post-session survey today to be able to tell us of any other suggestions. So thank you again for the plans to put your information in there, and then for the CBOs. Many of whom you see here identified already. If you go to the next slide here, I'll also make a mention that as I think Cynthia and others mentioned, they're not only joining today to kind of provide their contact information in the chat, but are going to be, I'm just really grateful because in a few minutes after some presentations from Sadhana and myself about some of the basic kind of TA topics for today, we also know that there's a really wonderful opportunity to have the plans themselves help field some of the questions that you might have today. So let's go to the next slide.
And just before we move off of this slide, I received some comments about, the selection of CBOs that are included in this cohort. And so just wanted to address that. You just mentioned that we got the inputs through a variety of ways. We worked with our plan partners. We've worked with CBO hubs like United Way or Sonoma Connect, where they've been helpful in disseminating information about these sessions. And so folks come to us saying, oh, we heard about this from this community hub, can we join? And so there were a variety of entry points to being part of the invitation to join these sessions. And so you will see, quite a wide range in terms of size of organizations. Really, we just wanted to make sure that these were organizations that are serving the community in meaningful ways. while they might be on the spectrum of contracting. So just wanted to address that kind of, I don't know if it's a selection process, but kind of the way that the names that you're seeing here came together.
Thanks, Alana. So last poll for today, I think, before we get into this, the substance of some of the presentations we want to share with you today, just to get a better sense of who's in line. We know how far you are along in your contracting process, but let's get a sense of how many contracts you anticipate engaging in within the next year. So let's launch the last poll. Nasra, please. So as a CBO, how many different CalAIM community support contracts do you anticipate engaging in within the next year? This may be if you provide multiple community supports with one plan and you're hoping to engage in one contract to address multiple, that's would count as one contract. But if you're looking at engaging 2 plans in one county or several plans in different counties, this is a good opportunity for us to let us know how many contracts you anticipate engaging in the next year. So let's leave this open maybe for 15 more seconds.
Folks are jumping in here. I'm already seeing, like you mentioned, Rishi, a little shift from previous sessions. We've been asking these same poll questions through all of our sessions to see the, kind of change in attendees. I guess familiarity with contracting. And so I'll leave it for 5 more seconds here. 5, 4, 3, 2, 1, and we can close it out.
Ellen, do you want to voice over the responses?
Sure. And so I hope folks can see this. It looks like, there are a number of you that are looking at one contract. About a third are looking at one contract, with a third not sure. And then we're seeing a few of you that are engaging in 2 or 3 or more contracts, which is definitely, ticking up from our early sessions where folks were at none, 1, or don't know mainly. So this is great.
We'll go to the next slide here, and Salvana, it's a question for you and for where we're at. Do you want to recap some of these, and I can then go through some of the recap of highlight 1, session 1? Yep.
Yeah, so thank you, Rishi. So part of our expectations for being part of this these sessions is that we do ask that you complete a post-session evaluation survey within 24 hours of today's session. We'll put it in the chat during today's session, as well as in the follow-up email. And then we do have a post-program evaluation survey, whether you joined both of these regional sessions, whether you joined one regional session, whether you've only done one of the TA sessions. They're kind of like 4 to 6 different touch points that you may have engaged in. We'd just like to get your sense of whether this was helpful, how it could be more helpful to you as we move in the weeks ahead. And that you'll be able to see resources on our website. We're putting together a page right now. Our page includes one of the statewide sessions, but we do want to set up some space for folks to be able to access previous recordings of these sessions and slides all in one place. We do hope that if you have plan-specific questions, that you'll contact the partners that we have on the call, who have been really gracious in giving their email addresses and contact information, and is also provided in follow-up emails. So really, use that to be able to reach out to folks. We do expect that the plans will respond to CBO questions. That's been part of our conversation all along. And I'm sure they'll be jumping in, like in previous sessions, to answer questions live here, as well as questions that might be more appropriate for a one-on-one venue. And our TA partners will be doing the same. We'll be answering questions to the best of their ability if it's not a plan-specific question, and sharing resources where possible. So with that, maybe we'll go into some of the highlights from the first regional session.
Yeah, thanks, Salvana. I think, and based on the notes that you've received from others who want to be responsive to people's availability, I'll spend a few minutes, not as long as we anticipated, on the highlights from regional session 1, and we can come back to this in the Q&A, so that people have a chance to get into the Q&A soon. So if we go to the next slide here, we wanted to take a brief moment here to review some of the topics we talked about in regional session 1, in case some of you weren't able to join that. We know, of course, that as we talked about in the last session, Partnership Health Plan of San Joaquin, and HealthNet have each identified community support services that they're planning for January 1st of 2022 in each of the respective counties here. And so you can see here a view of that. For those of you who are earlier in the contracting process, this might be helpful for you. For those obviously who are later in the contracting process, you probably know this. But as we go to the next slide, we wanted to just recap some of the topics that we talked about in the last regional session. We, in the last session, brought up what kind of vetting process plans in general are taking when it comes to community-based organizations that are thinking about contracting, some of the service requirements that exist for community support providers, including some of the data requirements and reporting requirements coming related to claims and billing, invoicing, and then finally credentialing and compliance. We're going to go a little deeper today into the credentialing, compliance, and vetting processes of this. So as we go to the next slide here, I'll just use the next couple slides as a touchstone that we can come back to today about that vetting process, for example, that we talked about a little bit in session 1. One important point is that providers are required, community support providers included, are required to be Medicaid enrolled where a state level enrollment pathway exists, Medi-Cal enrolled, I should say. But if there is no, as DHCS has identified, if there is no state level Medi-Cal enrollment pathway, managed care plans are required to vet the qualifications of provider or provider organization to ensure they meet necessary standards and capabilities. The MCPs, all of the MCPs, managed care plans participating in this network, the ones on the line today, are required, therefore, to vet CBOs that are interested in becoming a community support provider. As we go to the next slide, that means that each plan has specific vetting protocols that they're all following. There are some basic elements, though, that I think are true for all of the plans today. And again, we'll hear from them in a moment to add some more color and context and specifics to this. But in general, criteria that plans, again, consistent with DHCS guidance, the criteria that plans are required to consider as part of their vetting process include the ones you see listed on the left. The ability of a community support provider to receive referrals, of course, the sufficient experience to provide the services that they're proposing to offer, the ability to submit claims, business licensing that meets industry standards, the capability to comply with reporting oversight requirements. Important to note that that for all the plans, there is a vetting process that includes evaluating for any history of fraud, waste, abuse, and/or liability claims, as well as history of criminal activity. I think is another criteria that's again part of DHCS guidance that plans may consider, and history of liability claims against the provider. There's a lot, in other words, of basic vetting criteria that plans are encouraged to consider and need to consider to meet their reporting requirements and compliance requirements. So an important resource, again, we'll share this today as we've shared in prior sessions, is the DHCS provider terms and conditions document. We, as always, encourage community-based organizations that are interested in community supports to review the DHCS standard terms and conditions. At a basic level, as you can see on the right, though, it boils down to making sure that as a CBO, if you want to become a community support provider, that you have what you see here listed on the right: the experience, the history of providing services to the population you're targeting and serving, the capacity to provide culturally appropriate, timely, in-person care, and then the ability to communicate in culturally and linguistically appropriate ways. Thanks to Sadhana for putting the link in the chat for the terms and conditions. But again, this is a recap of what we've talked about in this past session, and we'll likely come back to some of this today.
And one thing I just wanted to jump in with, Rishi, is, given the kind of variety of, or like the continuum of folks on the call in terms of, already contracted versus starting negotiations, if CBOs here want to share with their peers some of the surprises that might have come up at this stage of the process, or, things that they wish their peers would know in kind of sister counties, please feel free to share those in chat. We found this to be really valuable during these sessions when CBOs are sharing with each other, kind of beyond what the black and white text of the terms and conditions are.
Yeah, I really appreciate that, Sadhana. Thank you. And as we go to the next slide here and then open it up for maybe a dialogue here, we wanted to then review, kind of double click, if you will, on some of the topics in regional session 1, especially that vetting process, and start to just recap what's needed for setting up a contracting relationship. Again, in the next slide, the next two slides, you'll see that in the standard terms and conditions, this is a reference document that we continue to encourage people to review. You'll see in those standard terms and conditions some of the provider requirements, as well as in the next slide, a review of delivery and payment terms and conditions, data sharing terms and conditions, and then quality and oversight terms and conditions. We've reviewed these in the last regional session, and some of these are topics we've also covered in county-specific TA sessions, and we'll continue to provide opportunities to do a deeper dive in the county-specific TA sessions with your plan partners. But for now, we wanted to make sure that as we talk about what's needed to enter into a contracting relationship, we always anchor back to the standard terms and conditions, at least as a starting point for those who are earlier in the journey. As you go to the next slide. We thought out of those standard terms and conditions, we'd elevate the first point here. This is all taken from DHCS, and what's grayed out on the top is the point that we made earlier that managed care plans, the providers need to comply with whatever process the managed care plan is put in place for vetting the provider. Another element, though, from the standard terms and conditions is that the community support provider, or ILOS provider, as was previously termed, should have the capacity to provide services in a culturally and linguistically competent manner. This is an important point to be able to communicate with your plan partner about directly, to be able to map to the populations and the cultural and linguistic information that the plans already have and the areas they're trying to address, so that in conversations with your plan partners, you're making sure that you're mapping your capacity to the needs that the plan is identifying. The other important part here at the bottom is that if a community support provider, if one of your CBOs is subcontracting with other entities to administer any of the functions of community supports, you're required to ensure agreements with each of those entities and make sure that those agreements bind each entity to the applicable terms and conditions set forth in the DHCS guidance. So again, the standard terms and conditions are really important reference points. We wanted to spend a moment as we go to the next slide here, reviewing what's really the high level of what's needed, and with credit and thanks to our friends at Partnership Health Plan of California, here's an example of some of the information they've shared in a recent webinar on what's needed for CBOs that are interested in community supports to move forward in their contracting process at the basic level. Tax ID and NPI, and we'll spend a minute talking a little bit more about how to get an NPI if you don't already have one, if you haven't gone through the application process. But there's other requirements as well, and some of these may differ by plan. They include setup forms for new vendors, verification processes for your business license, checking your certificate of insurance, and then there are other debarment checks as well that the plans themselves, in this case, for example, Partnership Health Plan itself would run. So we know that each plan, if for example, this is partnerships, but we know that HealthNet and HealthNet San Joaquin also have their own core kind of requirements for providers or would-be providers to be able to meet as you go through, as you're considering how to become a CBO, a community support provider. It's important to be able to be in contact with them. And again, this is why it's so wonderful to have the plans here today and have their contact information so we can hear from them today, but also so you can follow up with them. Let's go to the next slide and maybe double click on the NPI application process in particular, as we're educating many of you who are just thinking about getting involved in this process or moving forward. The NPI application process at a high level is the next slide. Is an application process for the NPI, the National Provider Identification. This is a 10-digit number assigned by CMS, the Centers for Medicaid and Medicare Services, and it's used for electronic claims transactions for healthcare billing and reimbursement. And NPIs are needed or required for all enhanced care management and community support providers, including non-traditional providers, in order to receive payment. What's important to note is that earlier, at least, this is true, and this what's in bold here, that employees and subcontractors of enhanced care management or community support providers were not required to have an NPI at that earlier in the process. But I do want to pause and ask if any CBOs who've already gone through the contracting process, or certainly plans, wanted to weigh in here and see if this has now changed, if it's important for CBOs to have, in fact, an NPI at the time that they're finalizing their contract negotiations. So I want to pause and see if anybody from HealthNet, Health Plan of San Joaquin, or Partnership Health Plan wanted to offer any comments on whether an NPI is required before the contract is signed, or if the application can be submitted, and if that's sufficient in order to proceed with the contract. And Chuck, great question. I'll get to that in a minute here as well, about how long it takes. But any comments from the plans about just clarifying or updating us on the requirements for each of your plans in terms of whether an NPI has to be obtained, or if an application for the NPI is sufficient to proceed with contracting?
I think I can weigh in. So we have provided guidance to all our providers to obtain an NPI, and I believe DHCS actually issued a guidance document, a step-by-step guide, and on how to do it and which taxonomy codes to select. For our application process, we were working with providers if they were in the process of obtaining an NPI or didn't have one quite yet. We did accept the application. However, for the most part, most of them found it to be a very easy process, a very quick turnaround time, and we really didn't have any issues in many of them obtaining the NPI.
Thank you so much. Invite our colleagues from Partnership or HealthNet to weigh in if that tracks with your experience too.
So this is Amy from Partnership, and we have similar experience. We are open to starting the assessment and contracting process with providers who may not have an NPI, but we're working with them to get one.
Thank you. And from HealthNet, Nai or Anna? And feel free, we can come back to you later in the chat if you're on mute now. But Cynthia, in particular, thank you so much for that. And Cynthia, as you rightly kind of pointed out, as we go to the next slide here, wanted to point out that there is a process here, and it actually seems to be so far, or at least a relatively straightforward process. And Chuck, this is now getting to your question. To get an NPI, you can apply online or by mail for free. There are some links you'll all receive to the application process, so we'll put those in the chat. And Sadhana, also thank you for putting in the link to the step-by-step application guide that Cynthia referenced. Online, the application can take 20 or 30 minutes actually to complete. And Chuck, to your question and to broader questions, it can take as few as 10 business days to receive an NPI number. It's important to know that you can apply either as an individual or sole proprietorship or as an organization for an NPI. But I think in practice, most of the community-based organizations that we have online today that have been identified, and I think many of the CBOs that plans are encouraging to kind of work with or trying to work with, are likely to submit as an organization, not as an individual as well. And again, invite our plan partners through chat to add any context if I got that wrong.
Yeah, and I would add also our implementation partners. I know we have some folks from Aurrera and from Transform Health that might be able to add some color to what they're seeing in other areas as well.
Was that, Sadhana, was that for?
No, just, if there's anything in terms of, Chuck's question or other pieces of the NPI application process that you might be seeing even outside of these counties. It's just inviting our implementation partners to weigh in as well.
Great. Yeah, thank you. In the chat, please do. And I know that there's been some questions that some CBOs have raised about whether to apply as an individual or a sole proprietorship or as an organization. And so please, if you have those questions or if our implementation partners have comments to weigh in on that, please do, as Sadhana said, put in the chat. We're recommending, and I think consistent with what we've heard from our plans, to apply as an organization where possible. If you already have an NPI, you don't need to submit a new application. But it is important to be able to review, as Cynthia also mentioned, the information that's in your application or in your current NPI profile if you already have one, especially when it comes to the taxonomy codes related to the services you're providing. That includes the taxonomy codes, and again, we'll provide a link, that link in the chat that Sadhana created. Give some good guidance as you go to the next slide here. We've summarized some of these in the next couple of slides here, this information on the taxonomy codes. DHCS has developed guidance, the link is in the chat, to help inform provider decision-making, but it's the responsibility of every community-based organization, every provider who wants to become a community support provider to select the taxonomy codes that are most accurate and reflective of the services you'll be providing. If your organization is applying for the first time, we encourage you, DHCS especially is encouraging that you ensure that the most appropriate taxonomy code is entered. You can enter multiple taxonomy codes for the services. However, one code must be selected as the organization's primary taxonomy code. And again, if you already have an NPI as an organization, it's wise to ensure that your taxonomy codes are current and reflect the current kind of licenses and services that you're going to be providing as part of a community support work. As we go to the next slide here, we've summarized what DHCS has suggested, and I think, Cynthia, this is what you referenced, suggested in terms of the taxonomy codes that you may consider using for the relevant community supports, which is what you can see on the left here, categories of community supports, and then the suggestions on the right of what DHCS is recommending or as a consideration for the taxonomy code to use, at least as a primary one. And again, as a reminder, you can identify multiple taxonomy codes, but need to choose one as a primary. This information is found in the link, but again, wanted to just provide this as a reference to illustrate the great information that's in the DHCS step-by-step application guide. As we go to the next slide here. While Chuck, your question was great, and it can, as we said, it can happen in as few as 10 business days to receive an NPI. The amount of time it takes to obtain an NPI is dependent upon the volume of applications being processed at any given time. Not surprising for many of you familiar with applying for any designation, especially a federal one like this. And it can also depend on whether you do it electronically or on paper, and whether the application was complete and passed all the edits at first. What CMS is recommending that indicating that any provider who submits a properly completed electronic application could receive this in as few as 10 business days, but paper application processes will take longer to review and complete. Errors obviously can delay assignment, and so it's important to be able to review this. This is a good opportunity, again, to engage. We're recommending not to apply for the NPI on your own. Check in with your plan partners, especially if they're seeing common patterns of mistakes or errors coming up. Jill, thank you so much for your comment there as well about in the chat and emphasizing the resource that Sadhana put in there as well. As we go to the next slide. We thought we just then, as we talk about NPI and the broader criteria that plans are using to be able to, in their vetting process, just remind ourselves that the NPI is just one of several different components of the vetting process and the credentialing process that plans have. So as we go to the next slide here, we wanted to just recap that as you're looking at that resource that's in the link, the NPI application step-by-step guide, also consider additional information from the plans themselves about what's required in the application process, the vetting process, and credentialing process. And you can see a list in the bullet points below of some of the things that might include, but it may not be limited to those things as well. So today, especially with our plan partners on the line, as we look at what's these resources, and we understand some of the basics that we've presented here today, we wanted to go to the next slide here, and I think really highlight some of the things that have already been shared in the chat about the relevant contact information. And I think now we're going to turn it over, Sadhana, back to you so we can get into an open Q&A now to field questions you have about the topics we covered today, as well as whether it's about NPI specifically or broader questions about the application process. So Sadhana, I'll turn it back to you, and thanks again.
Thanks for that. And yes, so we had, some of those contact emails and websites up on the screen, and they're in the chat as well. But really encourage folks to now unmute or join us in chat with any questions about this kind of early stage of contracting, either questions that you might have in getting credentialed, what kind of requirements might be needed, especially with our health plan partners and our implementation partners on the line, as well as what I mentioned earlier about if you've already been through this, what might be helpful lessons learned for your peers on the call in terms of that piece of the process. And maybe I'll also ask, have folks used this step-by-step guide? Thanks, Jill, for mentioning the utility that you've found in that guide. Have folks in getting their NPI, have you used this guide? just scrolling up to see if I had any other questions come to me directly. So I'm wondering, maybe if, thanks, Catherine. It sounded like when you went through this, and I know you mentioned that you had signed a contract already. So you've been through this early stage and the process seemed simple and quick. I'm wondering if you could just unmute and tell us a little bit about, were you involved in the process, or it was likely someone else in your organization?
No, we applied for the NPI early this past year in anticipation of CalAIM, and literally just went online, and it's quite easy to look up the taxonomies and make some selections about what you're going to do. And it was really quick, probably took 20 minutes, and we got notification right away that we'd been approved and what the number was. So it was quite an easy process.
Oh, that's great. So that 10 days was kind of a buffer in your.
Yeah, no, we did it online, and we got notification, I think the next day, or maybe even later that day, that we had been approved and what the number was. And then we got a mailed notification like within the next week.
That's great. Thank you for sharing that. I'm wondering, since if I could stay with you for a second, Catherine, since you did signal that you've gotten to the stage of signing a contract, were there other pieces of the kind of that early process of either vetting or certification that did take longer than you anticipated? It sounded like you all were early on the. I
mean, I think we were we were part of this, we were involved in the stakeholder advisory meetings for CalAIM. So we've been following the process for a long time, and we have existing contracts, not with the plan, but with others. And so, and we have been talking with partnership since early last year around medically tailored meals. So I think it was quite a simple process for us, but we were very familiar with what was happening in CalAIM. We have existing capacity, we have existing contracts, and so I think we were well prepared, but we found the process quite straightforward.
That's great. Thanks for sharing that. I wonder if there's any other folks, maybe also in those counties, Sonoma and Shasta, that have, thanks, Catherine, that are looking to build a contract maybe earlier in the process, and if you have any questions about what that might look like. I know in our last session, some folks did mention, they were so early in the process that they weren't sure how to start, and wondering if folks are having questions about, how to start.
Can I just maybe build on that? It's and ask our plan partners in particular, actually, if there's anything both about the specific points that we're just talking about, or the broader description of some of the requirements, just whether it's NPI specific information or the other requirements that we had shared, like the vendor setup form or other things. If any of you want to can take the opportunity now just to kind of voice over any additional information that has been really critically important for to be able to vet and onboard a potential provider. So wondering if we could actually just go to each plan and ask you to kind of share any additional comments.
So
This is
Debbie. Oh, sorry.
no, go Deb.
So for partnership, I think the best thing has been that we've been doing a lot of one-on-one calls because this is so new. that's a good word for it, new to all of us. And it has so many different adventures and different lanes on the freeway, if you will. So we've been reaching out to the individual community-based organizations and making sure that they know what we're looking for. And if we don't know what they need, then we find out and get back to them again. So we've been doing a lot of huddles, if you will, and then also doing outreach with webinars generalized for the different community supports as well as ECM.
And just on that point, Deb, I know we shared one of the slides from one of your webinars, or like the content of one of the slides from one of the webinars. If you would like to share any of those resources in chat for folks, feel free to put those in chat. I know we'll have a separate TA session for Sonoma, Shasta counties this afternoon, but just in case there's not overlap, feel free to share those partnership resources here. I'm wondering if HealthNet or Health Plan of San Joaquin.
Yeah, I would second that thought. I think it really requires individualized attention to both the providers as well as, I think explaining it to our internal staff and really going over the approach a few times. But definitely it has helped to have that constant communication with the providers. Sometimes a phone call can quickly help resolve, an application issue or something like that. So definitely that has been key here.
And this is HealthNet. I think the same thing, just having setting that time aside for those individual questions that we're all kind of like, learning all together.
That's helpful. Thank you for that. And so it kind of reinforces the importance of reaching out. I know that in earlier sessions and in conversations with CBOs, we've heard, when should we reach out to plans, what's appropriate, especially if they're new to contracting with a managed care plan, kind of like the opposite end of the spectrum from what Catherine was describing, where she's been in conversation for a couple of years for CBOs that are newer to this. It sounds like what we're hearing from all of you is, you're willing and able and encourage one-on-one conversations as much as possible to resolve any issues that might be causing hiccups here. And thank you, Amy, for sharing the CalAIM resource page from Partnership. And so maybe what I'll do is share some more of the resources that we've been seeing through this process from DHS and from Partnership, and really encourage other folks, whether you're CBO on the call, county on the call, implementation partner on the call, if there are additional resources that you would encourage folks to look at as you're going through this process, understanding that, your plan partner might be, one of the first calls you make. These are all linked that we will send out. So the DHCS websites, and then policy guidance that's all available online. We've kind of listed them out here. And also the webinars. The webinars have been really helpful in kind of describing what all of those kind of dense materials are intended to do and where you can find information. So we'll send these links out to the DHCS webinars that describe their guidance, as well as, we have that Partnership resource page here as well. And I'm not sure if Health Plan of San Joaquin or HealthNet have similar pages. I kind of remember from previous sessions that the resources are available kind of after community organizations are part of your conversation and kind of do some intake. And so again, really encourage folks to reach out to the plans to be able to gain access to that support that they may be providing individually as well. And of course, sorry. Move that up. The best resources are the counties. I mean, the plans. So looking forward to that. I don't want to belabor the questions. If folks don't have questions here, don't have things that you're trying to uncover during this session, I'll leave it just for a second more here. If either the plans have something that you'd want to share or our implementation partners. All right, folks. So I'll take us into next steps. You know, if you have any questions or feedback, please, you know, feel free to email us. We do have a survey where we are trying to hone in on what other topics you may want to see, especially because we have these county-specific sessions coming up. So if there are county-specific questions that are coming up for you and you want to share them ahead of time, you can either email us or the last question in our survey, or sorry, throughout the survey, we give that ability for you to indicate what TA topics you would like to see in future sessions, and hopefully we can get to those. And the remaining ones that we have open, we have our statewide on December 16th, which is open to all CBOs, all California-based CBOs, and then we have county-specific sessions next week in December 7th and December 10th for where we split up the two counties and kind of go with the plans and the counties in those plans and doing a deeper dive. As we mentioned earlier, it's by invitation only, but really folks need to reach out to us, and we do just a high level bet to make sure that they're serving those counties, and then we'll be able to provide the joining information to them. So please either use the survey that's in chat now. If you could just take 5 minutes, they're anonymous surveys. They'll take actually less than 5 minutes to fill out. It would be helpful for us as we expand the utility of this. And with that, I think we can close. Thank you all for being here today. We look forward to the continued communication and to seeing you on future sessions.
Thank you.
Thanks all.
Bye.